Hi, good evening, everyone. I am so excited to be a part of this conversation today. We have some wonderful guests joining us, and today we're going to be talking about the invisible strain, addressing mental health issues among immigrant workers in low wage industries. And I hope you all are excited, just as excited as I am. This is a very important topic to discuss. And I think that having these opportunities brings a lot of light for those in our community to have understanding and to be able to understand the fact that the discussions are happening, the conversations are happening, which often leads to progression in many ways. So the hope is that people are able to listen in, learn something, and be willing to take what they've learned and put it back out into the community to fill some of the gaps that we are experiencing when it comes to a lot of these important topics that we're talking about. So, I want to go ahead and do a roundabout introduction. I'll introduce myself and then I'll allow our guests to chime in. My name is Jadon Thomas, and I stand with Resilient Immigrants. And I will pass it over to Sarah, and we can kind of go from there.
Hi, I'm Sarah DiCarvalho. I'm a mental health clinician, a licensed mental health clinician, and I work for an organization that integrates behavioral health services into primary care and specialty care. Thank you for having me.
We'll take it to Melissa.
Okay, my name is Melissa Zipfel-Williams. I'm a licensed clinical social worker and a registered play therapist supervisor. I'm in private practice and I work with children, adolescents, families. I also do immigration evaluations.
Love it. Thank you. And Sierra.
Good evening. My name is Sierra. I run a private practice. I do immigration evaluations. I also act as and I have a long history in healthcare and working with immigrants. Thanks for having me.
Wonderful. Thank you so much for joining. So we're going to go ahead and pop off the conversation. And what we'll do is we'll start off, since we're in the beginning, we'll just start off in the same order that we did our introductions. But this is open discussion, right? So please feel free to chime in. Please feel free to double tap anything that you hear where it's just like, oh, I need to add to that. We can flow very easily. And so, yes, I'm going to go ahead and start with, what mental health struggles have you all seen immigrant workers face that aren't being talked about enough, whether it's in clinics, community spaces, or even amongst family and friends?
So you were starting with me, right? Yeah, I think the first thing that comes to mind, which might not be not talked about enough, is of course the trauma of the move itself, of leaving people that you love, the trauma of sort of living in hypervigilance and chronic fear. But one of the things that feels perhaps less talked about is the grief of that. And also sort of the cultural identity concept of coming into a new country where you're trying to sort of immerse yourself in that culture and feel connected and part of that community, and perhaps feeling less part of the old community that you were used to feeling a part of, and folks sort of coming to terms with who they are and sort of where they fit in the world.
Okay, I would just add the stigma of mental health, that there's that, what's wrong with me, or there's something wrong, or even asking for help. Sometimes I know some people struggle for asking for help, thinking that they're not being strong enough or they can't solve it themselves. And just knowing that there's a community out there that can be supportive to them.
Okay. I would
Sierra, did you
add,
have anything to add?
possibly just, yes. Is there a lag? There's a lag. Okay. I would add that the new awareness of mental health as something to pay attention to is probably an issue. Especially if you're coming from a culture where that is not discussed, it is not an option, there is no profession for it. I have quite a few clients where they're like, their parents are like, we don't know what that is. You just go, you get your job, you do your career, and you start your family.
Yeah, and what I love is that a lot of those answers really tie together. Melissa, were you about to say something?
No, I wanted Sierra hit the nail on the head.
Yes, yes, and a lot of them tied together because a lot of it has to do with culture shock, right? A lot of it has to do with, and I love, Sarah. I think it was you that spoke about the grief, right? That a person experiences when they're being either displaced from one location to another, or whether it's by choice from going from one location to another. It's one of those things where we don't name it grief as much as we should, and from that perspective, when you start to add in the cultural differences of, like, parents not agreeing that therapy or talking about mental health is so important, so a person just continues to go on throughout that. So a lot of what you all said ties really very, very closely together. And it leads into the next conversation about the impact, right? What impact does constantly working to make ends meet, or just keep going, or just please keep pushing it to the side, or let's not talk about it, like what impact does that have on a person's mental emotional health, especially when rest and self-care aren't options because we're not talking about it, or we don't know enough about what it actually looks like. So how does that truly impact individuals? And we can take it backwards, or you can hop in however.
I'm happy to kick it off again. I think what comes up for me at first, again, is sort of that hypervigilance and the concept of being in chronic stress, and kind of living in fight or flight. I think many folks, even who haven't experienced something that serious, have a hard time kind of stepping out of that from the day to day. And again, folks might be having a hard time even finding sort of the time or space to try to tap out of that, and try to sort of relax and to feel safe.
Yeah, exactly. And kind of along the stress or along the lines of chronic stress there, that traumatic experiences, these require our body and mind to respond to them. And in some way, well, in a lot of ways to survive, right? So we have changes in our hormones and our muscular contractions and our heart rate and our breathing. So a lot of that stress causes those somatic things to come up for people. And trying to regulate, but also trying to do your job and figure out and navigate resources and the things that you're coming into.
This is definitely substance use or somehow relying on what you know as a way to cope. And I think where substance use is not something that mechanism that's used. So probably or leaning really, really hard into more dysfunctional behaviors. I think these are major consequences.
I agree. I agree. And so when it comes to situations like that, right? And I think that a huge part of that gap is the fact that people either, because we talked about resources also, people either don't know certain resources exist, or they do know and they may not trust the system. They may not know how to navigate it, or it just sometimes it can be very overwhelming, right? And we as clinicians, we understand ourselves, like trying to find the process of trying to find a therapist, the process of trying to understand what mental disorders are. Even for us as professionals, it could be overwhelming, it could be difficult, it could be a lot, right? So when we're talking about a community of people that they don't study this, they're not, they have no awareness of it, and they're being introduced to it, and they are trying to understand how to trust this system while also, right, coming into a community where they're learning to trust all the additional systems that we know about. That could get very scary, that could get very icky. So how do we bridge the gap between clinical services and those people who really need them, and them understanding like these are safe spaces and these are resources that are very beneficial to you, and it's okay to say that you don't know or that you're scared, and we're here to help you.
I think a really, really important thing around that in terms of approaching that is getting it right with those who are accessing services so that they can go back and tell their communities that we are getting the feedback around what needs to be and what would be more helpful, what would bring people from their groups in, that and tailoring our services to meet people where they are. So for instance, something that the way I market myself is that it is conversational, that I'm removing a lot of the local language, that we do not lean heavily on what that looks like if we have insurance, those kinds of things, the specifics that exacerbate the stigma.
Yeah, I would echo what Sierra said. So the work that I do full time is integrating behavioral health services into primary care. And the whole point of that is because more people access this primary care than more other, behavioral health services, right? And so it's sort of like, hey, we're going to bring these services to where you are. And I often follow a similar vein to how Sierra described that. I often just want to kind of offer to people, hey, is it cool if we keep checking in every couple weeks? Is it cool if I call you again, rather than like, hey, do you want to engage in therapy? Because I think you're often much more likely to get folks to a yes if you're just sort of like, hey, can I check in with you again in a couple weeks, and sort of lower the pressure of what that conversation looks like for folks. And what drew me to that work and why I've stayed in that work for so long is some of the folks that I've been able to care for or see the companies that I work for care for are folks that I don't feel confident would have made it to a more traditional behavioral health setting, and were perhaps more open to it because they were there and it was happening. And so I think there's other places that there is a lot of work going on to integrate behavioral health care, such as into the legal resources and services or social services that folks are accessing already, and really help sort of streamline those pathways so that, if somebody is engaging with a caseworker or working through some of the legal stuff they have to go through, they feel trust there, and perhaps there can be sort of a warm handoff to a counselor that they can kind of continue that work.
Yep, absolutely. And I think Sarah and Sierra both said those things excellently. And going into the community, right? A lot of times some people are afraid to go into the offices because of what they might fear is there. So making connections within the community, if somebody's coming to you, how can we get into their social circles or those community centers to do, like Sierra said, have those discussions and conversations and make those connections within the community, so we build trust and then offer those check-ins so that everybody knows that, hey, we're here. Everybody's has access to those services.
I think the concept of community is a really important concept here in this conversation too. Even taking sort of the therapeutic clinical lens out of it, it doesn't always have to be a therapist. Though I'm a therapist, I believe really firmly in clinical care, but really engaging in a community and finding folks where perhaps you can find some of that support, because whether we integrate care or not, or we're in the communities, there will still be barriers and reasons that folks can't engage. And so sometimes I think we can maybe we have to lower the expectations sometimes and sort of take the pressure off ourselves that you can do some really meaningful, valuable healing with your community and with other people who are also doing their own healing. And perhaps that feels a little bit more accessible for folks.
I really, really love that community engagement piece in order to overcome the barriers that people are experiencing is a huge, huge part of what I think means to be an efficient clinician, or just a person who's able and willing to do this work. I think that it's important to be able to step out of the box, right? So as we're talking about different barriers, in addition to community engagement, and this is if you have ideas or not, but how else can you help someone who, say, doesn't have the time or language or even emotional energy to even begin talking about their stress or begin talking about their journey, or understand, or even think that it's something that they need to talk about? Like, are there other ways to help people like that?
I think the first thing that comes up for me, a question that people ask to therapists a lot is like, how do I get my mom into therapy? Or how do I get my boyfriend into therapy? And I sort of always say, like, you do therapy and you do the work. Because of course you're going to show up differently in all of those relationships. And people are more likely to feel motivated when they see someone that they know and love and care about reaping the benefits of something. And so I think the more that we as people and carers and humans kind of talk about our own mental health journeys and the work that we're doing, it does kind of create and normalize those conversations a little bit more, so that some folks who might never have considered seeing a therapist might be like, oh, wow, Sierra's talking about her therapist and how much she's gaining from it. Like maybe it is something I should think about.
Yeah, I would tag on to what Sarah said. I've found that I think one of with the particular community is if more people from the community come to me. I immigrant. I do not come from an immigrant family, but Jamaican. I have to assume that somebody went to a meeting and said, we go to her.
Yeah.
And I come and come and come. And I figure, okay, so I'm doing something right because they are recommending me.
Right.
So kind of back to my earlier point of trying to get who do seek out services, because there are people who kind of what else I can do. So I must go to a therapist. And in many cases, by the time someone comes to a therapist, they're in crisis.
Right.
So I think that's sort of my contribution to that question.
Right. Right. Yep. Just building those connections and, the word of mouth and how does this person support you? Right. And it happens once one comes and they share and they feel comfortable and safe with the clinician, then they go back and tell their friends and it kind of builds upon there to say this person has been helpful. So yeah. And I would agree with what Sarah and Sarah have both said.
I think also as a professional, being open to opportunities to be in spaces that an example I'll use is a very unique example, it's a very niche example, but I think it has worked. I was approached to be on reality TV shows. So I'm on 3 reality, and I get quite a few referrals from being on the shows. But what those shows do, even though it could be considered trash TV or, not the escapism, is it does normalize people going to talk about their problems on what it looks like to go talk to someone. So I've found that to be pretty helpful.
Very interesting.
Yeah.
That was a great example. Exposure, right? Like
Yes.
exposure and word of mouth. Those
Drop
are
those in the chat, maybe.
So I love it. And so as we're talking about meeting people where they are, right? Let's go through a scenario. Let's say someone is juggling 2 jobs. They have limited English and there's a lot of financial pressure that they're experiencing. What would be some mental health practices or coping tools that are actually doable and helpful for them to try?
I think that's going to come around mostly maintaining the balance around or trying to maintain balance. I don't know how much balance you're going to maintain with that kind of schedule, but staying connected to some kind of community. If you have family to talk to, staying in connection with family, going deep into your spiritual practices. That I think that's probably a big one. And this is all under the assumption that these things are not also harmful or things you're trying to get away from. So I'll start being with people that love or care about or who care about you.
And I would add, noticing those triggers within your body, what's coming up for you, and maybe taking a pause, stepping back, deep breathing. I mean, really that breath in, holding, and breath out. And going through your day and the moment of gratitude, what brings you joy, and kind of reconnecting with that to say, okay, this day has been rough and I have the bills and I have to go to my second job, but what was something about today that brought me joy? And breathing and taking a walk. I know sometimes that's not always a luxury for some, but even if it's on your 15-minute break, walking outside, down the sidewalk and back, just to get out into that fresh air, get the sunshine, soaking that in, to take that little bit of a break as a pause.
Yeah, I think my mind went to similar places, Melissa, that I think a lot of folks are kind of in chronic fight or flight. And it's not to say that we can turn that button off really easily, but we can build in little tiny micro moments in our day where perhaps we tap into our bodies a little bit. And so, again, I always kind of say to folks, like, lower the expectation. I'm not recommending like this meditation practice that's 30 minutes long. If you can lay down on your floor, on a yoga mat, or just on the ground for 30 seconds, a minute, and sort of just like tap into your body and center a little bit. If you can, as Melissa said, go outside for 2 minutes and just like feel the sun on your skin and really sort of get present in that. I feel like we maybe underestimate the power of those little moments that kind of like turn the dial down a little bit throughout the day, right? When all of the stressful things are turning it up periodically, these little things that kind of bring us back to baseline, I actually think are more powerful than we might give them. And I think, again, the other thing that comes to mind that Melissa referenced is nature. Like actually sort of immersing yourself. Again, this could be just like taking your shoes off for 2 minutes in the grass outside. It doesn't have to be this grand hike in somewhere beautiful and looking at this gorgeous path, but just kind of like listening to the birds outside, I think kind of connects you back to something really natural, and again, helps folks kind of connect in their body. And everyone's really busy and resources might be strapped and what have you, but I think a lot of times if folks really sit down with themselves, like they can usually find time to do a couple little things like that for themselves.
Yeah, I agree. So just finding ways to. Oh no, go ahead. Go ahead.
Oh yeah. I'd like to add, in addition to what Sarah said about taking people who may suffer from more extreme anxiety or a fear of sitting with themselves. So we haven't like approached that because we haven't accessed the services to really go deep, is doing things that require bilateral movement so that you are able to process. So taking walks, listening, tapping on your knees, and back and forth. Those are some things that maybe being overwhelmed with the quiet, if there is sort of a fear of like intrusive thoughts, or not wanting to think about the things that are affecting you. Also, another thing, this might be controversial. Another thing I recommend sometimes, especially if I have a particularly hard session, or clients are like very escalated, is to somehow engage all 5 senses and as soon as they can. So finding something to touch that you like touching, accessing a smell, or just being able to accessing sound, accessing is it taste. Another one is to eat ice cream. Now I know what's my sweet treat here or there is okay. Kind of automatically makes you feel happy. So I think, yes, it's cheap. It'll also allows you to access joy in a very sort of mundane way.
Yeah, thank you for bringing that up, Sierra. And I think one of the things that I'm thinking as we're kind of listing these things off is that all of these are fairly accessible, right? None of us said these like sort of really sophisticated coping skills that only are accessible for some people. But I often like to think of things of like, okay, what's low risk? What's something that anybody can kind of try, or, give it a go one time, see how it works for you. And I think that was true for most of the strategies that were shared.
Yeah, absolutely.
Yeah.
That was really amazing. And very much like, are we about to say something? No. No, okay. Very much focused on being grounded, but also here, I love the fact that you brought up people who are scared to sit with themselves, right? As something that we don't often think about. And yes, it's a goal, right, to reach to be able to sit with yourself and sit in silence, because that's how we become self-aware, and that's how we are able to, like Melissa said, be able to pinpoint how I'm feeling, right? If I'm feeling hot, then I know then my anxiety is increasing, or, that I'm about to go into fight or flight. But for individuals who have not reached that level yet, I think it's really important to highlight that some people are, kind of at the very, very beginning. So I love that you said that. And it's something that I'm keeping in mind too as I interact and engage with people, especially some of my friends. And so even saying that, right, like you all have mentioned a lot of great things, and a lot of our conversation relies on people being able to trust you, right? People being able to understand that what they're listening to is coming from a safe place. And so what do you think makes a mental health provider, or even a support group, because we haven't talked much about support groups, but individuals who go to a support group, what would make them feel safe and trustworthy for an immigrant worker, and what could possibly break that trust?
I can jump in.
Yeah, that's a good question, though.
It is.
I think some of the things that come up for me are things that would build or break trust in most therapeutic scenarios, like folks being reliable and doing what they said they're going to do, and showing up at the times they said they're going to, and showing respect. But I do think in this scenario, there's another element of sort of like not stereotyping and trying to demonstrate how much you know and understand about the culture, but engaging in, like, I remember learning about the concept of cultural humility versus competence. And at the time, I remembered feeling really sort of validated by it. Like, oh, I don't need to feel like I'm this competent expert in how to be culturally aware to all these cultures I couldn't possibly know. And understand the same way these folks do, but that I can have this humility that I'm always learning and listening and not judging. And I want to understand things from the lens of the person that I'm talking to, because their cultural experience and upbringing has been so different. And so I think that that's really important. And I think there's a fine line between listening and learning from the folks that we're working with, but also not relying on them to learn from and relying on them to teach us. So being open to the learnings that they're showing us in the moments when they're showing them, but also, frankly, doing a little bit of your own research in a couple minutes when you can, to try to understand sort of the culture and the things that folks are sharing with you a little bit more.
Yeah, and I think validating those lived experiences, listening, being vulnerable with them, some transparency, not full transparency, but saying, hey, I identify with this, or I understand how you feel, because not necessarily because you've been through that same experience, because you've done your work, or you've listened, or you've provided a space for them. Again, not trying hard to know everything, but understanding, validating, listening, being a support for them, and not, they're the experts in their lives. I'm not the expert. So they're coming to me, and I'm listening and holding that space, so that they can process, talk, do what they need to do to move forward.
I would add, in addition to what Melissa said, validate validate. Um, there is that the people need to feel like you're at the very least on their team. Like there's support. I think when we're talking about immigrants, we're talking about any group that is marginalized or oppressed. There tends to come with that some fear that they will be victimized again and over in these little ways and big ways. So validating, making sure that you're a safe space, but also making sure, like from a clinical standpoint, that you do a very thorough intake, a very thorough initial assessment so that you get a story, so that you understand what is going on. And I think at the very top of my list is being aware of your biases. Where are your blind spots? Where is your ignorance? And being humble enough to check it, um, get consultation, get supervision, or whatever it is that you need to be able to work through that, to make sure that you're still effective with your client and with your community, or with the people you're serving.
I love that. I think another word that popped into my head as you were talking, Sierra, when you were talking about the trust and giving folks time to learn to trust you as well, was patience. Clinicians we're humans too, right? It can be hard when you start seeing a patient or a client. You really want to be able to support them the best that you can, and you can tell that they don't fully trust you yet, and you sort of sometimes want to like move folks further down the line, like, hey, we can get there, we can do so much work like once we cross this threshold. And I think we need to understand that some of these scenarios require more patience, and that building that trust and that therapeutic alliance might take a little bit more time and a little bit more rapport than it might in some other scenarios.
Yeah, I love it. That is really great. And so what I like about everything that was said is this common theme of humanizing and understanding. The cultural competence part is huge. And I think that when it comes to being able to understand where a person comes from, whether they are an immigrant or whether they just genuinely come from a different culture, owning your piece in it and owning your responsibility in it creates the dynamic of humanizing one another. And so I want to lead into asking if you can share a moment, whether big or small, when you saw someone begin to heal or feel seen despite all the pressure around them.
I think a scenario is coming to mind. This isn't like particularly specific to one person, but I think that I've felt sort of this moment with a number of clients where we've been diving a lot into their history and the experiences that they've had, and they've really built a ton of insight into some of the sort of survival techniques that they started to use, and how some of those aren't serving them anymore, years down the line, or some of the patterns that have built up that are kind of maladaptive for them. And sometimes you sit in kind of this insight space for a while. I often kind of joke, it's like we're just realizing everything, and suddenly it's all so obvious. And sometimes you sit there for some time and we realize it, and it makes a lot of sense, and it helps us understand ourselves a lot better. But then I think there's this really exciting moment where they step into like integration and actually start, okay, I realize that pattern that I have, and it makes so much sense why I have it, and I don't judge myself for it. And now I'm going to choose something different. Right. And kind of this moment of like, now I see that, and I'm kind of stepping away, and I'm sort of rewiring myself to behave differently or respond differently. And so I think that looks different for different people who are going through different things. But I can remember that moment comes up for me with a couple of clients where I love the insight time. I love where they're starting to realize it and see it, and they're able to sort of like speak about themselves with such nuance and understanding. But I think that moment where they start to kind of change their behaviors based on that realization is really exciting.
I think sometimes the aha moments, like, the Oprah Winfrey tagline, the light bulb comes on and they come in and say, okay, we've been working, or I've been thinking, and look at this puzzle and I found the piece and here it goes. And we kind of sit back and witness with them that they've, we've just, like Sarah said, that realizing, just witnessing, and then they're sliding that in there to say, wow, okay, this is what it looks like. This is what I need to change, or this is how I need to move forward. So I think when the light bulb comes on is always a good, there's something about them when they come in, they're just like, I feel like, yeah, I think I've got it.
It is a light bulb.
This is a light bulb.
Yeah. And I love witnessing the joy that they kind of get to, like, they've done all, I'm like, you've done the work, right? You've done this work, and we've come to this realization. So.
Both of those are experiences I also have with my clients, but something very specific came up for me, and it's an example I actually use with my clients, especially if they start medication or come off of medication. But priors stop crying, and the people who do not cry start crying. Something has shifted, and typically in a positive direction, and direction of healing, whether it's learning to now feel your feelings, or being okay with feeling the feelings, or moving on to a new feeling. I think that's, to me, a really important indicator of moving into healing.
I love that example. I can picture that too.
Yeah.
And I think in that example, you just said something really interesting about the concept of crying, that it's not good or bad, right? It's just sort of information for different people.
Yep.
Yes.
Those are really, really good. It's the self-realization that I like to hear about. And I think that those are the pivotal moments that individuals remember themselves, right? And as we think about everything that we've talked about, I think that those are the conversations that they go back and have with people in their community, right? Where they're able to express, like, hey, I didn't used to be a crier, and now I so comfortable crying, and people are looking at them, probably knowing that they didn't used to be a crier, like, yeah, something's different, or it's the light bulb, or it's the hot, or it's the glow, right? Like once you're around people who genuinely know you as a person, they've been around you for a while, this is your community, and they start to see the shift and hear you talk about the shift, then that's when they're like, maybe I should go to therapy. Maybe that would be good. So that is probably my favorite question that you all have answered for this entire session. So we're going to go ahead and wrap it up with a final pinpoint discussion. I want to ask, what's one thing that you want immigrants, or in general, everyone, but specifically immigrants, to know about their worth, their strength, or their mental health that might be hard to believe, but it's absolutely true?
I think what comes up for me is the concept of immigrating is so big and challenging and brave. I can't even fathom it, right? That if you have accomplished that, and I don't want to oversimplify, doing the work, but if you could do that, you can do this, sort of. Like if you were able to do that, and you made the decision to do that and took the steps to do that, that you can look inward and do this inner work. Like you are absolutely capable of that. And a video comes to mind. There was a video I saw years ago, and it was a man talking about treatment for post-traumatic stress disorder. And he got really passionate in the video. I think he cursed, which I won't. But he said something to the effect of, what really makes me the most mad is that this treatment works. Like there's data that shows that it works. There's people who can come around and tell you their story and tell you that it works. And so the fact that like we're sitting here with this kind of like potential solution or something that will make you feel better is sitting here and folks aren't accessing it. That's what really sort of grinds my gears. And I think about that, right? That, hey, there's something that is kind of more probably a 99% chance that this is going to make you feel better in some way or help you in some way. And the hardest part is kind of starting it and getting yourself there.
Mm-hmm. Mm-hmm. And I would say, you know, you are here, you're here, you know, you matter. And just like Sarah said, this is brave. It's a big thing, and taking that step. And so knowing that there's a lot to navigate, but build that community, reach out, your social circle, listen to others, take into consideration what others are saying. You know, what resources are they tapping into?
I think what Sarah said beautifully about I've relocated several times in my life in states, and I think about how hard it is to move from state to state. Could not imagine having to move somewhere. There's a language.
Sierra, you're lagging a little bit. Uh-oh.
Side of the street, have to get used. Oh, well, I don't know what I can do about it, but I'll just keep talking.
Thank you. Thank you so much. I have enjoyed this conversation so much, like absolutely. And there's a lot of tidbits that I know that I'll be able to, of course, hold on for myself, but also be able to give back in my circle. So I really appreciate you all's time. Is there anything else that y'all would like to share before we close out?
I just like to go back to that. You know,
I think
go ahead.
what you were going to say was
I
probably
was
a
just
little
going to
bit
say,
more.
yeah. You know, mental health is health, right? So let's do it. You know, we go to the doctor or whatever, we do those things. Let's take care of ourselves. So mental health is health. The services are there. Again, tap into your community and let's do it.
I would just offer that if anyone just wants to have a discussion, not a session, just a discussion, that you can contact me via email. It's Sierra at the Healing Suite, or you can chat me on LinkedIn. My name, I'm the only Sierra Pierce. The only other one is blonde and runs track. You'll see me. I'll pop a discussion. I don't mind having a back and forth email or having a phone discussion or consultation or something like that. If you want to get some understanding, or just talk about some things, I'm available for that.
Yep.
Thank you.
I would echo the same. I'm certainly available. Folks can look me up on LinkedIn. I'm happy to chat with folks, and even folks who might not work in a clinical setting or, you know, need these skills for kind of a clinical sense, but maybe just want to open their eyes and their awareness a little bit more to sort of the concept and the struggles that folks are having. But I think my sort of final piece to the audience would be to really not underestimate the small things too, and the little rituals that you can create in your life. Like when Sierra referenced ice cream, like I'm picturing, you know, a family going for ice cream, and the family might be family you found here, might not be your blood family, or just having dinner together, breaking bread with people. Like those little rituals will in time help you feel more of a sense of community and a sense of home, kind of no matter where you are.
Yeah.
Yep.
Well, thank you so much. We have come to the conclusion of this session. This was done very well, and I appreciate y'all's time. And I look forward to being able to have more discussions like this. Thank you so much.
We appreciate you. This was done well.
Yeah.
Your moderator.
Thank
Yeah.
you.
Yes.
Excellent.
All right, you all enjoy your night.
Thanks,
Yeah,
guys.
thank you.
Take care.
Thank you.
Bye.
I don't actually know how to hang up. Oh, there we go.
Leave
I found it.
there.